The XCellaris Pro Twist is a new generation of device. So this is a very different type of microneedling device. The XCellaris Pro Twist has some unique benefits. You're getting a very clean trauma into the skin. This is the fastest device on the market. The more microchannels that you create, the more fibroblast activity you have. So we're making that very clean trauma and clean, precise wound into the skin. Hello, so I'd like to talk to you today about the XCellaris Pro Twist invented by Dermaroller. Dermaroller are the inventors of microneedling. We established in 1999 and we commercialised and industrialised the first ever Dermaroller to the market in the year 2000. We launched a series of home rollers as well as medical rollers. We also brought out our first electronic device, the eDermastamp, in 2013. And then we saw a gap in the market for a better technology, and in 2022 we launched the XCellaris Pro Twist, which I'm demonstrating here for you today. The XCellaris Pro Twist is a new generation of device. The XCellaris Pro Twist has some unique benefits. So it has active needle retrieval. The needle architecture is very important, and also the speed. So this is a very different type of microneedling device to what you might see out on the market at the moment. The XCellaris Pro Twist is ergonomically shaped, so you're holding it as a practitioner like this in your hand, and this is forcing you to go in at a 90-degree angle, which means you're getting a very clean trauma into the skin. The active needle retrieval, what this means is your needle is being driven into the skin and being drawn out of the skin at the exact same rate. So we have a very fast movement into the skin, and this again is causing a very precise trauma. We have the speed here, so we can choose anything from 50 Hertz all the way up to 150 Hertz. The faster we go, the more comfortable it is for the patient, but ultimately this is the fastest device on the market. Other devices may go up to around 100 Hertz. With 150, you're creating more channels every single second. So if we have 6 needles on our cartridge and we use a speed of 150, we're actually going to create 900 channels just in 1 second. In 3 seconds, you will treat 1 square centimetre of the skin, and this would create 2,700 channels. The more microchannels that you create, the more fibroblast activity you have, the more collagen is produced. So the XCellaris Pro Twist, you can choose anything from 0 millimeters all the way up to 2.5 millimeters. So this device can be used for nano needling as well as deeper microneedling treatments. We can use it for various indications, which we'll go on later on. So you can see here, we insert the needle directly onto the motor. So by inserting the needle directly to the motor, this is demonstrating now the active needle retrieval, where the needles are being driven into the skin and retracted out. If I turn the device on, you will see that the needles are driving in and they're driving out. So we're making that very clean trauma and clean, precise wound into the skin. You can change the depth of the device here. So when we have 0 on the barrel and we have 0 on the side, which is your millimeters, we have a window here with a black marker. We can click up to 0.25, we then have 0.5, 0.75, we then come back to 0, but you can see this black marker is now indicating to 1 on the side of the device. So we're now at 1.0, and we can keep on scrolling all the way up until we get to 2.5 millimeters. Now, if we look at the shape and the architecture of the needle, this is very important. Our needles are a 32 gauge needle at the very base, so it's a thicker diameter, and this is grinded into a sphere shaped until we get to an endless tip. So you imagine when you are treating patients at the lower depths, such as 0.5 millimeters or 1 millimeters, we're putting a less diameter of needle into the skin, which makes it much more comfortable for the patient. When we're using the device and we have it switched on at our high speeds, what we have inside the device itself is vibration. So you can hear this vibration now. Now this vibration is actually going all the way down the handpiece, and this is causing a nice vibration onto the skin. And so what the patient is feeling is actually more of a massage on the cheek area, around the chins. They will also feel some slight wind as it's moving so fast. So it's a very cooling, relaxing treatment to have done. It's not like other microneedling treatments. The device is plugged into the electrics directly, so it's not battery operated, which means you can have consistent speed at all times. So you can turn the device on and off with the foot pedal, which helps reduce the cross-contamination. You can cleanly place the microneedling handpiece into the XCellaris Pro Twist control unit, and here you have clearance, so that is not touching the surface, so that we're keeping sterile at all times. All of our needling devices come sterile in single-use packages, and they come as a box of 5, and everything you see here is made in Germany. So it is a German engineered device, and everything including our skincare products, needle modules, are manufactured directly by Dermaroller and sent to you. So I'd like to talk about the needles. We talked earlier about the needle shape and architecture. So why is there 6 needles with our device? And maybe some devices on the market have 12 or 16 needles. Actually, if you have 6 needles spaced widely apart, this is going to make a clean entry into the skin. If we look at the option to have more needles on a cartridge, what this can do is actually cause the needles to catch onto the skin. Because the denser the needles are, you have something called the fakir effect. So if you imagine someone laying on a bed of needles or a man that walks across glass, the reason we have 6 needles is so that we don't have the fakir effect. Now, 6 needles spaced widely apart means we get a clean insertion into the skin, and we need very little pressure to go into the skin. We look at other devices on the market, they may have 12 or 16 needles as an example. However, this will cause the fakir effect. So if you can imagine a man that lays on a bed of needles, or someone that can walk across glass, the reason they can do this is because the glass and the needles are so densely arranged. It means when they lay across the needles, their weight is evenly distributed, so they're not sinking into the needle itself. However, if they were to lay on one needle, it would go straight through the skin. So by having 6 needles, we get clean insertion into the skin, we get precise insertion into the skin, and we're displacing that trauma very finely. With more needles on the cartridge itself, what you'll find is that the outer needles will catch in the skin, and these are causing micro tearing under the skin, and they're also causing surface scratching. It's only the inner needles that are actually inserting into the skin. Historically, with microneedling, you would be used to a lot of erythema on the skin and lots of pinpoint bleeding. However, we do know from recent studies that we actually only need mild erythema to produce collagen. And to produce collagen, we would need to needle at a depth of 0.5 millimeters. And at 0.5 millimeters, you will be activating your growth factors and your fibroblasts within the dermis to then produce collagen. So with nano needling and microneedling, we can treat different types of indications. We can treat patients that suffer with wrinkles, fine lines, uneven texture, uneven skin tone. We can also treat acne scars, whether that be rolling scars, ice pick scars, or box scars. We can treat patients that suffer from hyperpigmentation and surface melasma. We can treat patients for hair loss and thinning, as well as medical scars and striae. Now, we do use different depths depending on the different indications. So if we were treating patients for mild rejuvenation, wrinkles and fine lines, we're looking at around a depth of 0.5 to 1 millimeters to produce that collagen production. For patients for acne scarring, we're looking at 1 millimeter to 1.5 millimeters. So we're going to go a little bit deeper into the dermis and hit that lower part of the dermal layer to produce more fibroblast activity. If we're treating patients for hyperpigmentation, we're actually going to treat at a lower level, so 0.25 to 0.5 millimeters, as we want to be able to target the melanocytes in the epidermal junction and that are also living in the basal cell level of the epidermis. For hair loss and hair thinning, we want to create a small amount of pinpoint bleeding, and we would be looking at treatment between 0.5 and 1 millimeters for hair loss. And for medical scarring and striae, we would be looking at a 2.5 needle length with top speed to produce, again, more fibroblast activity, more collagen production and skin tightening.